Dr. Scott Sherr, thank you so much for coming on. You and I have been talking for a couple of months now, just learning about each other. I'm learning about your products. I'm learning about Methylene Blue. I'm learning about all the ways that your brain thinks about things, which is fascinating. So
Mm.
I'm excited to have you on because this is a topic that I have not yet covered on the show.
It's exciting to be here, Amy. Yes, exciting to be here with you. And then we'll have you on our podcast as well relatively soon, too.
I know it'll be fun. It'll be
Yeah.
fun. So yeah, like I said, I mean, you're brilliant in this space. I mean, you're basically like at the top level of researchers, scientists, doctors that are really diving into the body and our biology, biomechanics, and finding things that actually work to help people with sleep, to help people with energy. And we're going to talk about all of that today: anxiety, depression, the whole thing. What
Mm.
got you into studying all of it? I mean, I don't want to pigeonhole it into methylene blue. We're going to dive into that for sure.
Sure.
So hang
Sure.
tight, everyone. We're gonna talk about it. But what brought you into this space of really diving into methylene blue and all the things to help people?
Yeah, it's always a question as to where to start with that kind of story. But I'm an internal medicine physician by training. I grew up the son of a chiropractor. And chiropractors are the OGs when it comes to alternative medicine, when it comes to alternative health, and thinking outside the box. And I often say that my father didn't have a box; it was just maybe some lines someplace. But changing diet, changing lifestyle adjustments and things like that. It's been part of my life since I was born, basically. And so my whole life really has been a journey getting back to a place where I was able to learn how to create a clinical practice that integrated a lot of different things together that was focused on health. And the focus on health took a long time to finally arrive. Let's call my initial work was outside of the conventional world, was in hyperbaric oxygen therapy. And that's a field that I still work in primarily a decent amount of time, and I've been doing it over a decade. And then I created an integrative practice around that. But what was missing was a foundation piece to that. That foundation was an understanding of how energy was produced, how detoxification was happening, and understanding also that if I was putting people in a hyperbaric chamber before they were ready, they wouldn't do as well as they potentially would have if they'd had great optimization, great work done on a foundational level first. And so met a colleague in 2017 named Dr. Ted Achacoso, and he had started this nonprofit called Health Optimization Medicine and Practice. And this is a nonprofit organization that we set up in 2017 that's training practitioners like me and like you, Amy, and others that are looking to optimize health rather than treat disease with their patients. And this became the foundation of my hyperbaric practice. I signed on as on the nonprofit as the head of education, the chief operating officer as well. And this nonprofit, though, and the focus was training practitioners, but we knew at the same time when you're trying to optimize the health of your patients and clients, you need to be able to help them right now. And we know that health optimization, taking this process can take a long time. It can take years sometimes to feel better. And I'm sure either your journey or in other people that are listening, their journey, they know it can take a long time to get from where you want to go to get to where you want to go from where you are. And 0 to 100 sometimes, it can be a significant roller coaster and an adventure to say the least. And so what can you do along the path to help you? And that's where our for-profit entity called Transcriptions came around. And that's where we developed multiple different types of products to help you right now along that path. And certainly methylene blue was one of the major things that we came across. And it really fits the bill of something that can optimize our ability to make energy and to detoxify and do it very, very quickly along that path when it takes a lot longer to do certain things like optimize your thyroid function. So,
Well, I think every MD and DO needs a chiro for a doctor because that's just proof positive that it expanded your mind from the start
oh,
to
yeah, yeah.
be able to say, like, listen, I can't stay, as you say, in the box of conventional medicine. If we really want to help people and help them get well, not just put a band-aid on them, but actually help them live their best life and feel amazing as they're living their life, we have to think outside of the box. So, I mean, I'm happy that you broke out of that. I'm happy your dad was a chiropractor. I think it's kind of cool.
I was lucky. Yeah. I mean, a
I
lot of
know.
people have to go the opposite way, which is they learn conventional medicine and either it fails them personally or it fails them in somebody in their family. And then they have to start looking outside the box and they have to figure out what to do. And go from there. So I was lucky in the capacity that I started off that way. I'm very unusual in that way. But I've came across multiple different things and multiple different specialties, of course, and lots of different types of practitioners over the years. And I've created my own clinical practice now that the foundation of it is this health optimization medicine piece. And then I still am very much involved in hyperbaric oxygen therapy. And then I work in a framework that gives my patients a holistic frame of understanding tools, technology, supplements, practices, and things like that. And some of the major tools I use, of course, are the ones that I produce with my companies. But of course, that's not the only thing that I produce as well. The only thing that I recommend as well. So
Well, yeah, no, I'm the same. And I think,
yeah,
immediately people think like, oh, okay, well, they're going to push their supplements. And it's not about that. We create supplements or whatever nutraceuticals, whatever you want to categorize them under. We create that because of a passion within us. And number one, what we see out there, sometimes some companies that are not so ethical and not so
for
great
sure.
quality. And that makes us go, and I know I'm speaking for you right now, but I think I can. That makes us go, you know what? We need to be better. We need to give these people high quality. We need to give them something that they're going to see the results. And then it's about ease and convenience too. If you have everything or mostly everything, I'm the same way. I'll recommend different companies, of course, because neither one of us can make everything in the
Of
world.
course. Yes.
So it's about having the tools available to your patients, to your audience, so that they can use things that in your heart of hearts is going to help. So I love that. I love that you do that. Methylene Blue. It's funny. I consider myself a biohacker, but when I get around other biohackers like Nat Nidham, who's so far down the path, she'll be talking about things, and I'm like, girl, I haven't even tried that or that or that yet. So it's funny. So I'm hanging out with Nat and she's talking about
Gotta love Nat.
methylene
Gotta love
blue. I
Nat.
love
Yes.
Nat.
Yeah.
She's brilliant too. And she's talking about methylene blue. I'm like, what is this? I have another chiropractic friend that every time we go to a conference, her tongue is blue. I'm like, somebody please explain to me what is this little piece of the puzzle that I'm missing out on? And then we're
Yes.
connected. So can you
Yeah.
dive in? What is methylene blue? What are we using it for? What is it?
Yeah, so methylene blue has been around a long, long time. It was the first drug registered with the FDA back in 1897. So it's been around a long, long time. Initially, it was a textile dye that was used to dye blue jeans. So if you had blue jeans in the 1870s, they were dyed with methylene blue oftentimes. But it was interesting. The transition to being an anti-infective happened around 1890s or that time frame. It was a treatment for malaria. It was actually at high doses of methylene blue. It was a fantastic treatment for infection. And in fact, it was called the magic bullet for this reason. And it was the original magic bullet. And what that meant is that you could give methylene blue at very high doses to people, and it wouldn't really affect their cells. It would just kill other cells that weren't supposed to be there, bacteria, fungus, and virus. And so until the 1950s, methylene blue was really the primary antimicrobial available until the 1950s, and when antibiotics and other antimicrobials came on the scene. And so it's had a very storied history in that capacity, then went out of favor when antimicrobials came around in the 1950s. Because there are some certain side effects when you take methylene blue. The major one is that it concentrates in your urine and it makes your urine blue. So there were songs about this in the 1940s during World War II, and it was used as a compounding agent. So it was actually compounded to other drugs in the 1950s and 60s to make sure that people were taking their medicine, for example. So because if people were taking their medicine, then they knew if they were or not, because their urine would turn blue, or it would not if they were taking their medicine. So it's been a long history with methylene blue since that time. The first antipsychotic drugs were actually derived from methylene blue, something called chlorpromazine, because it has some capacity to increase some of the neurotransmitters in your brain, like norepinephrine, serotonin, and dopamine, which can be very, very helpful for mood boosting and for a number of different other reasons as well. And so, but over the last several decades, really since the early 2000s, there's been a lot of interest in methylene blue because it is also a cellular stain. And this is how I first learned about methylene blue back in medical school. And where does it stain actually? It stains the mitochondria. So what that means by staining, it just means it concentrates in the mitochondria, which is, of course, the battery or the powerhouse of your cell. And now we know that there are about 8 or 9 different mechanisms about how or exactly the ways methylene blue can work in the mitochondria and help you make more energy. And not only help you make more energy, it also helps you with resilience and detoxification at the same time. and it has this quality called being a redox cycler. All that means is that it can donate electrons to part of your mitochondria called your electron transport chain, which helps you make energy or ATP, and ATP is our energy currency. And at the same time, it can pick up what are called reactive oxygen species or free radicals or inflammation and neutralize them as well. And so it has this dual capacity to give you energy. Even if your mitochondria aren't working that well, it can actually compensate for multiple different areas where on your mitochondria it may not be working. And actually, methylene blue can help either bypass those areas or support those areas to work better and help you make energy. And then at the same time, helping you with the detoxification side as well.
So why are we not using this more? I have so many questions just around what you just said. Number
Sure.
one, you were introduced to it in medical school. So conventional medicine knows of its benefit,
They
but
do.
I've never heard of it being used in conventional medicine. Is it?
So it is, yeah. So it's actually used in emergency rooms. So there's a couple different reasons why. The first reason is the most common. It's something called methemoglobinemia. And this is basically a condition where you cannot carry oxygen on your hemoglobin, which is the molecule that carries it on your red blood cells. And there's a lot of different reasons for this. One of the major reasons is carbon monoxide poisoning, actually. Another is if you get overdosed with certain types of things, if like you're a huffer, if you huff paint, it prevents your oxygen from binding to hemoglobin because it changes the conformation of the iron on there. So anyway, so in emergency rooms for like ODs and crazy things like that, you can give people methylene blue and it can help you actually start being able to bind oxygen and actually save people's lives. And so it's on the World Health Organization's list of essential medications for this reason. And the second reason is something that I hope nobody ever has to experience is cyanide poisoning. So cyanide poisoning, what cyanide does is it destroys one of the complexes on your mitochondria, prevents it from working, complex 4, actually, if people care about that. But what methylene blue can do is it can help rescue mitochondrial function by maintaining the flow of electrons through that electron transport chain, despite this complex 4 being destroyed. So it's good to have it around in case cyanide's around, that's for sure. But that's why it's used in emergency rooms. And it's also in other countries, it's being used in other acute situations like sepsis, for example, because if the blood pressure drops very dramatically, if you use a lot of methylene blue at very high doses, it's going to help deplete something called nitric oxide, which we all love. But if you have something called inducible nitric oxide, which is a different type of nitric oxide that happens with inflammation, it dilates all your blood vessels, causes inflammation, that can cause badness. And so it is used in that context as well.
Okay. So we use it, it's been around for a while. We use it in the ER. And now moving into when you described it for detoxification and for improving the mitochondrial function, helping to produce ATP, why are we not using this on a daily basis? I have this category of supplements I call like the no-duh supplements. These and you may or may not agree, but they're like the vitamin D, iodine is in there. I'm a personal
Sure.
fan of iodine, magnesium, things like that. That's like, why wouldn't we take these every day? It's starting to sound like methylene blue should be under that no duh category. Why isn't this more in mainstream? Why don't we know more about it? And do you agree that it should be a no duh supplement?
So, I mean, what it comes down to, I mean, you know this too. I mean, 95% of the US population is metabolically unhealthy. And that means that 95% of people have some element of mitochondrial dysfunction. So, in context, thinking about that, is something methylene blue that almost anybody could benefit from at some point? The answer is probably. But is it the only thing that they need? No, of course. The idea really is how are you optimizing mitochondrial function? Are you optimizing vitamins, minerals, nutrients, cofactors, detoxification? But the issue, as we were talking about, is it takes time to do that stuff. And so you can use methylene blue early on in the process to help support the system. And there is some evidence that actually it helps optimize and regenerate mitochondrial function when you do it. So the short answer to your question is that the reason why it's not as well known is because it is in a category that's like an OTC kind of thing, where it can be prescribed as a drug, and it also is something that can be found over the counter. And then it's been around such a long time that people just don't even think about it because you can't, as a drug company, patent anything with methylene blue because it's been around forever. It's a grandfather drug. And with all these things in mind, and along with the issue that it does turn urine blue as well, that it does not have a place in that category for many people. But, over the last 4 years or so now since we launched the company, I mean, methylene blue wasn't even a thing before we launched in 2020. We were really the first company to bring out a product that had methylene blue. And then the other reason why it's such a challenge, Amy, is that it's very difficult to find clean sources of methylene blue. It is a synthetic ingredient. It's not something that naturally comes from the ground or anywhere else. Doesn't mean that is a bad thing. Of course, we take many things that are synthetic, and many things that are natural can also be bad for us too. Let's
Right.
be clear. But because of that, when it's produced, if it's not produced in a very, very controlled manner, it can often be contaminated. And the major contaminants are not ones that anybody wants: mercury, lead, arsenic, and cadmium. And so there's actually a great headline in the beginning of the pandemic, maybe 6 months in, when we were selling products that we had. It was biohackers taking fish tank cleaner to reverse their age. And this is where we go, right? Because the fish tank cleaner is very likely and very commonly has methylene blue in it. But unfortunately, fish tank cleaner also has lots of contaminants in that methylene blue because it's not for human grade consumption, of course,
Right.
right?
Right.
So clickbait headline, very well done. Getting people to click on the headline there. Taking fish tank cleaner reminds you of like the ivermectin stuff, the horse dewormer things
Right.
down in the pandemic too.
That's what I was gonna say.
So
Joe Rogan got slammed for horse dewormer.
yeah,
Right. I'm like, he's just taking something that works, people. Just,
and it was prescribed by a pharmacy, and it's yes. Now, should people be taking fish tank cleaner with their methylene blue? The answer is no, they should not. They should be finding a good source. But it took us about 9 months longer to launch the company in 2020 because we had to go very, very far to find a clean source. And every single batch that we test again for the same stuff and we've had to throw out more than I'd like to comment on because of the quality issues that we've had or that are in sort of the space of getting methylene blue. And this even includes methylene blue that's actually USP on the label, which is hypothetically a pharmaceutical grade type of methylene blue. But even that can be contaminated. And so when you're going online and trying to buy it, you have to be really careful. Like if you're going on Amazon or something like that and you're getting USP, you don't really know. They could just be putting USP on the label. You really have to make sure you're getting information from the company with their certificates of analysis, their testing, et cetera. And even pharmacies that get it, they always get this, of course, as a prescribed drug, but because it can be prescribed at compounding pharmacies as well. But even those certificates of analysis, I've actually compared to the ones that we have, and ours are still better. So it's an issue. And so those are the reasons why it's complicated, right? It's not as a simple thing just as you can buy it online and you just know what you're getting. It's going to be okay. You have to think about quality. You have to think about the delivery mechanism as well. That's a big one. So like methylene blue can also be in either liquid form. That's typically how it's dosed, or we have what's something called a buccal troche, which is a dissolvable lozenge.
Mhm.
Much easier to dose, much less messy, et cetera. So lots of different things have made it very difficult for it to be one of those daily things that you take. But do I think that most people could benefit on a regular basis? The answer is absolutely yes, especially at low doses. And that's another thing we can chat about, but the dosing does matter here as well.
Well, and that's like anything, right? What's the saying? The dose makes the medicine or the poison. Or I'm not saying it properly, but
Yeah,
it's all
you're right.
in.
Yeah.
Yeah. I mean, and in this case with methylene blue, the source makes the benefit or the poison because just like you said, and I was going to bring that up. That's going to be a question on my listeners' minds because they've all heard it. I've heard it in chatter online and on Facebook. Ooh, well, it's a fish tank cleaner. And that's why
Yes.
I wanted you to please come on and clarify that because there's huge differences in where you get it and what type you're using. Obviously, for human consumption is a bonus, but then to speak to what I talked about in the very beginning, quality, quality, quality. When you have someone like yourself that has thrown out batches and lost money, essentially, because I know I've been there. I've been there. It's hard. It hurts the heart. It really does.
It is.
It does. It's pain. But
It is.
but
Yeah.
you ultimately you want the best for your people. You want the best for your customer. And you
Yeah.
don't want
Yeah.
them coming back, either not getting results or getting adverse results. So I commend you for that. So I'm glad you brought up the fish tank cleaner thing because I was going to too.
Yeah, there's 4 docs on my team, including me, right? We're all in clinical practice. We're all seeing people. We wanted to create a company with products that we would trust so that we could give them to our patients and our clients and feel confident that they were getting exactly what they were getting. So everything that we get is tested, both purity and potency, both from our manufacturers, from the ingredients themselves. And then we test every batch that we make as well of every single product to make sure that purity and potency is exactly on point. And this is not, as you know, Amy, very common in the supplement world because there's no regulation that's required. Where this is all self-guided regulation. And that is a big challenge. And so when you're looking at your supplements and the companies that you're working with, you really want to work with companies that do the extra testing, that go the extra mile. And we certainly do that.
And yeah, and we don't want, I always say this too, we don't want the FDA coming in and regulating our
Totally.
supplements because that's going to be a disaster. You're going to be right back to big pharma controlling everything. But to your point, Scott, yeah, absolutely. You just want a reputable company. And when it is an individual, I've been saying this for years, even before I have my own line, when you find that the company that you are buying your supplements from, is owned by an individual that has essentially their reputation on the line, that's where you want to buy because big corporations, they don't care. There's no reputation to any one person.
Right.
But when you have, a person with their name behind the product, I think that just up levels it. So yeah, talk to me about the dose. What do we have to look for when we're using?
Yeah. So when with methylene blue dosing, it's really interesting, right? Because if you have like really low doses, some people might call it like a microdose, somewhere around 4, 8, 16 milligrams, that's where you're going to be supporting mitochondrial function. So if you have chronic inflammation that's been ongoing for a long period of time, if you have brain fog, if you have issues with mitochondria, really anywhere, but especially sort of more low grade kind of issues, then these lower doses can go a long way to kind of supporting mitochondrial function, making you feel better. So, where do we have our most mitochondria, right? We have our most mitochondria in our brain, our heart, our liver, our skeletal muscle, and our sexual reproductive organs. So our ovaries actually have the most mitochondria per cell, and sperm are not that far away. So why are we having so many issues with infertility? Mitochondrial dysfunction. Everything sort of ends up being a mitochondrial dysfunction issue. So these lower doses are really good for more chronic, relatively low grade inflammation that's been ongoing for long periods of time. And we're just seeing amazing things. I mean, I've seen people with brain fog and fatigue for for years. They start taking some low dose methylene blue, and all of a sudden, like they can think again over just a couple of days. It can be very, very, very quickly. Uh, However, if you have a much more significant mitochondrial dysfunction, if you have more of an acute issue, an acute infection, acute trauma, acute ischemia, an acute infection, then the higher doses, somewhere around 1 milligram per kilogram or a little bit less than that, so around 50 to 70 milligrams, might be a better dose for you. Usually split up between 2 doses in the same day, typically like 25 milligrams in the morning, and then maybe another dose around 2 or 3 o'clock in the afternoon. You typically don't want to take it too late in the evening because it is a mild monoamine oxidase inhibitor, which all that means is that it prevents the breakdown of certain neurotransmitters, including norepinephrine. So this is another reason why people get significant amounts of energy when they take methylene blue, is that they have more energy coming on line in their mitochondria, and they have more neurotransmitters available to give them more focus, more drive, and give them a little bit of a mood boost. So the spectrum of dosing I typically recommend for people is to start off at the low dose, really no matter where you are on your health journey, unless it is more of an acute issue where you have an acute trauma, ischemia, infection, then starting at the 25, 50 milligram dose makes more sense. We have a professional line at Transcriptions that has a higher strength troche called Tro Plus Blue, and this is a 50 milligram troche itself, and that's only for professionals. But our consumer facing one is 16 milligrams. And what I'll, even for most people, again, unless it's an acute issue, what I'm having them do is start off at like a 4 milligram dose, and then increasing their dose every 3 to 5 days until they start feeling the improvements that they're looking to feel. And sometimes it's hard to know initially when you're taking just methylene blue by itself because it's working on mitochondrial function. So some people will feel something right away. Some people may not feel something right away. It may take them a little bit longer. It just depends on the person. But the way we developed all of our products is in something called a buccal troche, which is a dissolvable lozenge that goes between your upper cheek and gums and then dissolves in the cheek mucosa up here. So there's a lot of benefits to that. The major benefit is it works faster that way because it doesn't have to get digested through your whole system. And then the other benefit is that it retains the bioavailability of your ingredients, which means that when we swallow things, typically we lose potency of the various ingredients that we take in. That's just the natural part of the body detoxifying, not necessarily detoxifying, but digesting our stuff and going through our liver overall.
Mm-hmm.
And so that's called first pass metabolism for people who like big words. And so when you have a buccal troche, you don't have to worry about those things. So you don't have to worry about digestion and losing potency, and you have a much faster acting type of thing. Now, but the only caveat to that is, at least with just blue by itself, with methylene blue, no matter how you take it, whether you dissolve it as a troche or you swallow it, you're still going to get the same mitochondrial effects because it's highly bioavailable regardless, but it will work faster this way, but it will make your mouth blue.
Right.
And not everybody wants their mouth to be blue. But just to finish up on the dosing, so I'll have people start off depending on what they need it for. If they have a lot of brain fog and fatigue and concentration issues, it is better in the mouth if they can dissolve it here. Or if they're going to swallow it, at least do it on an empty stomach. That tends to be the better way to go. So the spectrum of dosing is wide, but it really depends on what you're looking to use it for. And then, but even people that have more potential to need it at higher doses, that have been chronically sick for a long time, I usually start it off at lower doses and rise it over about 3 to 5 days, increasing the dose.
Okay. So this is something that essentially you want to take every single day for almost like a stackable effect over time, right?
At least initially, and when you're first starting it on a daily basis usually makes sense. And then, but over time, as you get an understanding of how it makes you feel and what are the other things you're kind of doing to help hopefully optimize your cellular function, you can usually peel it off. Like on average, if you're relatively optimized, maybe 3 times a week is what I would usually recommend for people. If you need it more, if you're traveling, so you can take it multiple days, of course, if you're traveling, if you're more stressed, if you're not getting as much sleep, those kinds of things. And so you can use it more during that frame. But if you have a chronic inflammatory issue, autoimmune problem, toxicity, mold, or some other infection, then you may need to take methylene blue more regularly initially as you're getting your system all optimized otherwise.
Okay. That makes sense. Well, you sent me a boatload of your products, and I've had such a good time playing around with them, and we've talked offline as well. So I'll kind of give the audience my experience, my feedback as well. Well, first of all, with the turning your mouth blue, do not freak out. It doesn't stay that way, because I know that was my first thought. And I'm texting my friend Lisa, who her mouth has been blue. I'm like, how long does this last? How do you get this out? What do you do? Should I just brush my teeth 5 times? What should I? She's like, don't panic. It'll go away. So yes, your pee will turn blue, if not green. And so will your mouth, your teeth, and your tongue. Not to panic, totally goes away. Number 2. So as it turns out, I was messaging you, Scott, and saying like, I think I'm so optimized, I don't really notice a difference, but I also wasn't using it every single day. So when I started actually using it on a more regular basis, that's when I noticed more of a difference. Now, for me, I have to go up. I have to do at least a half a tab.
Yeah.
The quarter just
average.
doesn't.
Yep.
Yeah.
Half is about average for most people.
So what's really cool is they're scored. So like Scott said, they're 16 milligrams, but they're scored. So you can literally break and do a quarter or a half or whatever. So you can really easily dose yourself. So when I went up to the half, that's when I noticed it more. And then, like we were talking before the podcast, when I really noticed is when I felt like crap. So went out for my birthday, had some drinks, late night, going to bed later than I'm like a 9-10 o'clock girl. I can't go to bed at 1 a.m. That screws up my whole system. Talk about mitochondrial function. Jeez.
Sure.
So woke up, felt like crap. So that's when I took was it the Canatine? Am I saying that right?
Canatine. Yeah.
And that was like the defining, I'm like, I am back to life in an hour. So that was amazing. So to be able to feel that difference was incredible. Now, the sleep and the calm, I used to have sleep issues. So I've just kind of added the sleep to my stack that I have found works. And the calm I haven't really needed to use because I'm not that anxious of a person, but I would love to give this to some of my patients or friends that tend to be more on the anxiety side and get more feedback from them as to how they actually feel. Now, I know we're going to talk about GABA too, because a lot of my listeners, they deal with anxiety. They deal with mood changes and the brain fog that you talked about earlier. So let's talk more about like, let's kind of segue. That's my experience with it.
Yeah,
I
yeah.
mean, I really think it's
I
wonderful.
commend you. Yeah.
Can you talk to me more about people who are, let's say, let's go into the sleep and the calm realm, how they can use those trochees and what's in them that's different? Is that just methylene blue, or what else are you putting in there to kind of help?
Yeah, so let's break it down. I think when you're talking about the blue carnitine for a minute, just to go back to that.
Yeah.
So blue carnitine is not just methylene blue, but blue carnitine is actually a combination of things. It's a combination of methylene blue, caffeine, CBD, and nicotine. And so this is our nootropic stack. It is a fantastic way to improve your focus, your concentration, but also protect your brain at the same time. So methylene blue, as mentioned, is helping you make more energy, as is nicotine and caffeine. We'll get to nicotine in a minute.
Mm-hmm.
But the CBD is in there as well to also help protect your brain so that you have the methylene blue protecting, you have the CBD protecting, and you have the caffeine, nicotine, and the methylene blue helping with energy all at the same time. So it's like 3 to 5 hours of focus, productivity, or a reversal of hangover symptoms in your case. But that's a very common way people use it. They use it for jet lag as well, getting off an airplane. You have to be on right away. That's a great way to use blue carnitine. And it is a great way to just drop into flow. And that's what I love about blue carnitine. And people get worried about nicotine, okay? But nicotine is a fantastic nootropic. It's a great brain enhancer. You just don't want to smoke it. You don't want to vape it. You don't want to use it with any of the additives that are in cigarettes or in vaping products. And you want to keep it extremely low dose. So in a vaping or cigarette product, you have 25 milligrams of nicotine per cigarette, 25 milligrams of nicotine per vape or whatever puff, I think. And when you're looking at our product, we have 1 milligram in a full troche. And that is on average broken up into a half, as you were describing before, Amy, into a half a troche as the average dose to feel this way, this 3 to 5 hours of focus and productivity. And so you're getting just a half of a milligram of nicotine as that in that kind of in that half of a troche. And as you said, they're very easy to break up. So you can start off with a quarter and see how you feel and go to a half and go to a full. But once you find your dose, as I mentioned, it is not subtle. I mentioned it to this before the podcast. Like it's not subtle when you find your right dose of blue carnitine, but you're like, oh yes, now I
Yes.
know how this feels. And
Yeah.
now I can drop in and do what I need to do. And but I mean, at the same time, as we're looking at the ADHD world of that it is the world now. Like you don't have to have a diagnosis of it now to really have concentration problems, as we know, just because of phones and interruptions and everything else that we have. Concentration is a big issue. So we need to drop in to flow, but we also need to calm down, right? And this is where the GABA products that we've created really fall into is that we knew that a major issue that many of us have is what we would call, and it's what's been described as something called GABA deficiency. And GABA is our neurotransmitter in our brain that calms down the firing of neurons in general. So it prevents the firing or decreases firing, and that calms us down. So when we're anxious and we're stressed, we typically have about 120,000 thoughts per day. It's a lot of thoughts. Don't believe what you think, ladies and gentlemen. But
Right.
in general, we have 70,000 thoughts on average for an average human at this point. So, and then interestingly enough, this hasn't changed since we were Paleolithic, right? So the amount but the amount of information is just bludgeoning us. We're just getting bludgeoned by stuff. And so this continues to go up and up as far as how much input we have on a daily basis. And so what GABA is trying to do is actually regulate the flow of all these inputs that we're getting, and it's doing a really good job most of the time, but sometimes it just gets overloaded. And as a result of that, we become overloaded and excited and tense and nervous. And so working on the GABA system was a big part of our push when we were creating products, because we wanted to help people right now with their anxiety, with their stress, and with their sleep, which almost always can be benefited or can benefit from some extra GABA floating around.
Okay. Yes. There's again so much going through my mind. So let's break this down for my peeps that are brain foggy, sluggish. They can't think. I mean, this is a lot of thyroid too. And
Yeah.
this is
Yeah.
even some of my patients that we are getting optimized. They might say like, yeah, I'm good in all areas. I'm losing weight, all this, but it's just my energy. My energy is not coming back, or my focus. I just can't focus. So I think this is great. That's where I would add in the
The blue
carnitine. Now,
carnitine.
is there
Yeah.
something else that we should add in for the brain fog?
Well, I think the other thing I think about here is just our pure methylene blue on its own as well. So
Okay.
oftentimes in these kinds of people that have some mitochondrial distress, they have the brain fog and they need to feel better now, but you also want to support them. What I'll often do is give both. I'll give both the pure just blue and I'll also give the blue carnitine. And the just blue will be something that I'll give regularly. And then the
Mhm.
blue carnitine is when they really need to get things done.
That
Um,
flow.
and, and and
Right.
then sometimes even in the same day. So we have we call it our get shit done bundle, of course,
Oh
GSD.
my
But
God,
when
I
you
love
have
that.
yeah, it's
Oh.
yeah, it's blue carnitine in the morning and then just blue in the afternoon to keep kind of maintain that flow without the caffeine in there, which can keep people up if they take it too late in the day. And look, we've tested this internally. Clinically, we've done this with our own patients. We have practitioners that use it. I mean, and then of course, regular everybody else is using it too, and having these kinds of experiences. So yeah, I mean, I think it could be a great combination. So when somebody comes in with sort of chronic inflammation and brain fog, it depends on kind of where they are in their journey. But if they can tolerate caffeine already, if they're already drinking coffee and it's not causing them to crash for 5 days, then blue carnitine is a fantastic option. If
Mhm.
they're drinking a cup of coffee and they're like, I can't tolerate caffeine and I can't do anything because I have the stimulants and they make me crazy or I can't move for 3 days, then
Right.
starting with a just blue is the way to go.
Yeah, I was gonna ask you about that because you always have those people, and I get this question too with my products. How much caffeine is in even something with a little bit of green tea? I'm like, it's like 1 to 5 milligrams, but some people are that sensitive. So how much caffeine is in the cannatine?
So in a full troche, there's 50 milligrams, 50, which is about the equivalent of a quarter cup of coffee. So it's
Right.
not a huge amount at all. And again, on average, the dose is about a half a troche for most people. So you're getting about 25 milligrams of caffeine.
Yeah,
Most
that's
people
not
can
bad.
tolerate that pretty well, but the way we formulated prescriptions is that we use very low doses of things in a very synergistic way. And as a result of that, even though it's only a small amount of caffeine overall, just because we have the little nicotine in there and the methylene blue, like you do feel this huge shift, which is when people realize they just took like some people just a quarter of the blue carnitine, for example, which is what I take. That's a quarter of 1 milligram of nicotine, and that's 1/4 of 50 milligrams of caffeine. And then I'm still like, oh my goodness, this is fantastic for 3 to 5 hours. I'm like, what can I do? Like, what copy can I write? What calls can I make? What podcast can I record? Those kinds of things.
Yeah.
I already speak fast at baseline though, Amy. So I try not to take too much before podcasts.
Well, yeah,
So
no, same, same, same. Yeah. Yeah, but
I'm more
hey, maybe
calm
we can
before.
write like a book in a day,
I
something
know.
like
Yeah. Yeah. But interestingly, like for somebody like myself who's already kind of amped up, then using the GABA system can be very, very effective at improving performance because what happens when you're anxious all the time is that you're stressed all the time. Your fight or flight hormones are just crazy and you can't get enough blood flow to the front of your brain when you have all your what's called your executive function.
Mhm.
And common scenario, you forget your lines when you're about in front of people when you're about to give a speech or something like that. Your mind goes blank. It's like and that's because you're so sympathetically driven. So if you can just calm things down a little bit, then all of a sudden you start performing better. And that's where the GABA products really come in handy is that they can just take the edge off, like our Trocom, for example, which is our product for stress, anxiety, tension, Zen like qualities, is that you can titrate the dose. You could take a quarter just to take the edge off just a little bit, a
Mm.
half to take the edge off a little bit more, but that may just be enough to turn your brain back on so that you can actually perform better. And so some of us don't need more stimulation. Some of us need less, and that is less is more in this case in some people, and myself included.
Okay. So that's where we get into GABA and the
Yeah.
neurotransmitters. And can someone who is on an antidepressant also add this in?
So with the methylene blue containing products, methylene blue does increase serotonin in the brain. And you have SSRIs, which also do this, and SNRIs and antidepressants in those
Mhm.
categories. So you do have to be careful combining your antidepressants or antidepressants in general with those categories of things with methylene blue. Now, is it a showstopper? The answer is no. Like you can definitely do this, but it should be done with the help of a practitioner to just monitor you to make sure you're okay.
Mhm.
The major risk here has never been described with oral methylene blue, especially at low doses, which is something called serotonin syndrome. This
Right.
is very, very, very rare, and it's only been shown in IV methylene blue with very high doses of antidepressants. So what I recommend if you're on antidepressant, you're interested in using methylene blue, is you talk to your provider about adding it in and just monitoring your symptoms over time. You shouldn't have any, really. The one major one that we've come up with sometimes is that most people don't know this, but we produce much more serotonin in our gut than we
Yeah.
do in our brain. And so if you have more serotonin in your gut, it may cause some gut symptoms, like maybe having some looser stools, for example, which can
Mm.
happen. But in essence, in clinical practice myself, I haven't seen any issues. We have psychiatrists that are using methylene blue to help wean their patients off of antidepressants. But again, this is only being done in a clinical
Right.
perspective. And I would not recommend anybody stop or start or change any of their meds without talking to their doctor, et cetera.
Correct. Absolutely. Because you'll crash. But no, I'm thinking of a friend of mine who is listening to the podcast, and she just tends to have ADD.
Yeah.
And I've witnessed it. Like start one thing, bounce to something else, forget that she started that, go over here, come back to this and finish it. But yeah, ADD, and then more of a she flips back and forth between anxiety and depression. So, but she is on Wellbutrin.
Yeah.
So what would I'm just giving this scenario so that people listening can be like, yes, that's me. Yes. So what would you then use for her? I would tend my thing would be let's use the Just Blue for the ADHD at least through the day. I don't know about the Canatine. I'll let you wean in on that. And then the calm throughout the day when her thoughts go rampant and she gets anxious.
Yeah, it's a really good question, and a lot of this is so individual. So it's very difficult to know exactly the best type of scenario here. But in general, people with ADHD or ADHD-like symptoms
Mhm.
love blue carnitine because they love how it makes them feel, which is very similar to stimulants that may have had either taken from friends or prescribed at some point in their life. Okay. But the nice thing about it is it's only 3 to 5 hours. There's no come down, there's no crash, there's no anorexia associated with it. Sleep issues aren't an issue, et cetera. Okay.
Oh, you're
So,
talking like Adderall and right, because when
right.
people use that, the most fascinating thing with Adderall that I've ever found is people who actually need it become calmer, people who abuse it become hyper. So if you
Yes.
legit need it, you're right, that would put you into it goes back to that flow with the Canatine.
Right, exactly. So it depends on the person, right? If they have a clinical diagnosis versus they have, mild inattention and where they go. And so what I'll often do in patients in my own clinical practice here that are on antidepressants, depending on the type, like so Wellbutrin's typically a more stimulating antidepressant. It has norepinephrine and other kinds of things, and it may have some serotonin in there. I can't remember off the top of my head, but anyway, I'm just very careful. I typically will start off at very low doses and then I'll see how they feel. I'll typically start off with something that's non-stimulating, hypothetically, which is our pure methylene blue on its own. And then I'll see how they feel depending on how they react. Some people are hyper responders. They'll take the pure methylene blue on its own and then they'll feel like they're on something like Adderall, which is unusual, but it does happen. Happens
Yeah.
to me actually. So I have to be very careful when I take the blue carnitine. It has to be really like when I really need to lock it in versus taking the Just Blue. I can take that on a regular basis and get a lot of focus and productivity out of it. So it really depends on the person is what it comes down to. But the idea really would be to start off with the less stimulating, like the Just Blue by itself, and then add in something like the blue carnitine as well down the line.
Okay. And then where do we use the GABA then? Or
Yeah.
the
So
calm?
Yeah, so it's interesting because when you're looking at the GABA neurotransmitter system, right? Right. This is the GABA. This is a system that's about 20% of your brain's neurotransmitter system. So it's a lot of what's going on there. And GABA is it's funny because norepinephrine, dopamine, serotonin, everybody's heard of those. And like those that get all the fancy press and everybody thinks about dopamine. And these are definitely important neurotransmitters, but GABA is the one that rules them all because GABA is the one that's regulating the flow of neurotransmission for the most part. And it's doing this across the brain, everywhere in the brain and the spinal cord as well. And when I was talking about all that information that's being inputted all the time, GABA is trying to regulate that. And so GABA deficiency symptoms can run a number of different ways, but if you're GABA deficient, you're often more depressed, you're more anxious, you have overall a predilection for more addictions, including alcoholism, which makes sense because alcohol affects the GABA receptor. And so if you're taking stimulant medications, if you're taking or you're drinking lots of coffee, you're actually decreasing the sensitivity of these GABA receptors to bind, and then you're increasing the ability, or unfortunately, the ability to have more anxiety and things like that. And then if you're on pain medications, if you're on opioids, these also decrease the sensitivity of the GABA as well, so decrease GABA in the brain at the same time. So what we wanted to do was create two different products, one called Trocom and one called Troz. Trocom is a product that modulates the GABA system using 4 different ingredients. One that's called nicotinyl GABA. This is a vitamin B3 attached to a GABA molecule. And what's nice about that is that GABA itself does not typically get across the barrier, the blood-brain barrier, very easily. If it does get across, it usually means that somebody has a leaky brain. And that sounds scary, but all that means is that they have a leaky gut. And then all the membranes aren't doing their trick or doing their job of preventing things from getting across them.
Mm-hmm.
And the brain is unfortunately collateral damage of a leaky brain, a leaky gut in this case. So GABA itself shouldn't work. If it does work as a supplement, it could mean, doesn't always mean, but it could mean that you have like a leaky gut and maybe a leaky brain. And so vitamin B3 attached to a GABA, so nicotinyl GABA here, doesn't have that problem. Because vitamin B3 is attached, it gets across the blood-brain barrier without any trouble at all. And then it hydrolyzes or breaks up into vitamin B3, which is mildly activating. And then the GABA itself, which is obviously calming. And then that's nice because it doesn't make you feel tired when you take Trocom. It just makes you feel like you're less anxious. It's kind of an interesting feeling for people when they don't feel anxious, but they don't feel tired. It's kind of a weird juxtaposition of feelings because typically if you don't feel anxious when you're anxious, you're also going to feel tired. Like your benzodiazepines, for example, your Ativans, your Xanax, your Valiums, they're going to make you feel tired at the same time as they're going to make you feel less anxious. So we have nicotinyl GABA in there. Then we have kava, which is a plant from the South Pacific that's been around for many, many generations, thousands of years, that helps with calming the nervous system, affecting the GABA system.
Mm-hmm.
Then we have CBD and CBG, both non-psychoactive cannabinoids, also working on the GABA system and doing it also within the endocannabinoid system, which is another one of our body's brain system for balance overall. And so it's a fantastic formula. And like, again, a quarter to take the edge off, a half to take it off a little bit more. And then you can even use it before bed if you're one of those people like me or many of my patients that have a mind that won't stop racing with those thoughts that are in the thousands and multiple thousands. And you can just calm down those thoughts enough. And interestingly, as well, it may help you perform better if you're a guy in the bedroom because it does help with performance anxiety. Performance anxiety is a stress response and also is ejaculation. But parasympathetic is erection. So you can keep erections longer without getting too sympathetically dominant. In clinical practice, this is what I see with my patients telling me, and this is how it's being used. So it's nice that you can use it before bed in that capacity. But we also have a complete sleep formula called Tro-Z. And Tro-Z is a comprehensive formula that includes both your ability to help you feel sleepy and induce you to sleep, maintain your sleep, and also wake up feeling rested. Also, if you do wake up at night, there's enough GABA around in the formula that you can go back to bed even still.
Oh, okay. I have one patient in mind. I'm going to be talking to her tonight that, oh my God, we have tried everything. Like we're at the point where we're like, just go get a sleep study. Because we don't even
that's
know.
important. Like, do the sleep things, right? That's what I always tell people. It's not just Tro-Z is the way to go for everybody, but if you're trying to dial in your sleep and you're having a hard time, this is a great way to try to reset your pattern or take it regularly if you need to. It has a little bit of melatonin, a little bit of 5-HTP, and it has some significant ingredients that are working on the GABA system. One from a psychedelic mushroom called Amanita muscaria. That's not psychedelic in our formula at all. The mushroom psychedelic because it has something else in it called ibotenic acid. This is the Santa Claus mushroom. This is the mushroom from Alice in Wonderland. But for our purposes, we're using, it's called Agarin, and it's a long-acting GABA agonist. So it works on the GABA system. It works all night. So you have to take a very low dose of it, just 1 milligram in a full troche. Half a milligram or half troche is the average as well for this one. And then it also has hanukkale, which is from magnolia bark that works on GABA. And it has something called cordycepin, which is another mushroom derivative from the cordyceps mushroom that works with deep sleep. So it enhances the architecture of your sleep. It enhances your ability to maintain your sleep, which is really hard for a lot of people.
Right.
Your benzos of the world, your THCs of the world, these screw up deep sleep. And even though they make you feel like you went to bed, you do not get good sleep with these things. So the architecture is something that we really cared about when we were looking at this formula. And it's extremely comprehensive. And I would say about 80% of people who take it get a benefit. And that's, even though that may sound like that's not a lot, that's a huge amount for somebody that is working on sleep, because sleep is such a heterogeneous thing. So many people have trouble with sleep, and there's so many reasons why. So we're very happy with it. And especially if you're over about 45 years of age or so, or 40 years of age, and your hormones are starting to change and your melatonin is starting to go down, and even men, you're included here too, andropause is a real thing,
Yeah.
then this is really where in the population we've seen the most benefit. Anywhere between like 40 and 60 years of age seem to be the sweet spot for this one.
Well, and I am a benzo former addict for sleep,
Mm.
because from the age of 25 to really 45, I had to take that or Benadryl or Tylenol PM or something to sleep.
Oh,
Still
wow.
to this
Yeah.
day, no clue why. However, now I've transitioned, but I'm going to transition again. So now that we've talked, I'm going to try and use the Tro Z and take out the Delta 8, because right now my
Yeah.
stack is Delta 8 and kind of a blend of the 5-HTP and melatonin and valerian
Sure.
root.
Sure.
And that seems to be a great stack for me. But I know I keep hearing over and over again that the THC keeps you out of deep sleep. So I need to get off the Delta 8 and bring in something like the Tro Z instead.
Yeah. Delta 8's a great inducer overall. I don't know how it affects deep sleep compared to Delta 9, with
Delta
the regular
9.
THC. Yeah.
Yeah.
I don't know I don't think we've done any studies this way, but yeah, give it a try. I mean, I think that sleep is, again, such a challenging thing. My emphasis with most of my patients is working on sleep routines, working on sleep habits, screen time, all those kinds of things, and having your sleep routine that you can do almost anywhere you go in the world is the way to do it. But something like Trozy can be really great in a pinch. It can be really great to take you out of a tough time when you're having a hard time sleeping. And yeah, I'd be interested to see how it goes with you, Amy, overall.
I'm going to do it. I'm going to do it and report back, and then we
Please
can
do.
follow up.
Yeah, please do. Yeah.
Well, Scott, I mean, you've covered brain fog and energy and focus and flow and anxiety and sleep. I mean, you really run the gamut of all things that my audience deals with and suffers with. So I thank you greatly for coming on and laying all this out, because this is just another thing, another tool in your tool chest that you can try, that you can put in, that if things that you're doing right now aren't working, let's switch over and let's add these products to see if that can't take you to the next level to take care of or check all those boxes that we just talked about. So I'm so happy you came on. I'm so happy you taught me today as well as my audience. So can you let people know about your podcast that I'm going to be on, and then how can they get any of your wonderful products if they want to try and take it to the next level?
No, thanks for having me, Amy. So our podcast is called the Smarter, Not Harder podcast. And Amy, you'll be a guest soon. And we'll love to have you on. And yes, it's a great time to talk to some amazing practitioners and lots of different types of variety of people in the health, wellness, math, physics, Nobel Prize winners, and things like that. It's been fun. I mostly work with yourself and others on the practitioner side and do the interviewing, because that's where I live, right? And that's where you live.
Yeah.
So the company is called Troscriptions. It's the word troche and the word prescription mashed up into one, Troscriptions. You can find us on the web at troscriptions.com, on Instagram at Transcriptions. And we have a lot of information, a lot of blogs that we've written on all of our ingredients, all of our processes, our team members, the people that we work with, and it's been a fantastic journey. And again, these are tools, like you said, Amy, and the key really is to think of them that way and to understand that for us, we're clinicians first. So what I care about mostly is not you taking our products, is that you're optimizing your health over the long term. And these products can sometimes help you along the way. And the hope is that over time, you don't need something for sleep because you can just fall asleep, or you don't need something for anxiety because you have good ways of dealing with that on a day-to-day basis, and you have a meditation practice or whatever it might be. But what we can do is, because they're so fast acting, between 15 and 30 minutes, just put it up here, let it dissolve, and like in 15, 30 minutes, you're going to feel the shift when you get to the right dose. So I just recommend people give it a try and check it out and learn more about it. And yeah, thanks so much for having me.
And we'll put all the links in the show notes. Thank you so much, Scott. I appreciate you.
My pleasure.